Have you ever lifted your arm to greet someone, only to notice that the skin on the back of your upper arm keeps moving even after your hand stops? Many people laugh it off and call it bat wings, assuming it's just a normal part of getting older or gaining a little weight. But what if that loose, swinging skin is actually your body's way of sending you an important warning? Most people spend years trying to hide it under long sleeves, buying expensive creams, or believing cosmetic procedures are the only solution. Yet very few ever ask the most important question: why is this happening in the first place? The truth might surprise you. After years of studying how the body changes over time, one thing has become incredibly clear. Loose skin on the back of the arms is often not simply about excess fat. In many cases, it reflects changes happening beneath the surface, where circulation, connective tissue, and muscle health all work together. When these systems stop functioning at their best, the skin begins to lose the firm support it once had. The encouraging news is that your body is designed to repair itself when given the right kind of stimulation. You don't necessarily need expensive devices or complicated treatments to begin improving the condition of this tissue. Sometimes the simplest daily habits can create the biggest long-term changes. Before we dive deeper, if you're someone who enjoys practical, science-based health advice explained in everyday language, make sure you stay with me until the end. What you're about to learn could completely change how you look at aging, not just in your arms, but throughout your entire body. Let's begin by understanding what is actually happening beneath your skin. Most people imagine skin as a single sheet covering the body, but it's much more complex than that. Think of it as several layers stacked together, each with its own important role. The outer layer is the skin you can see and touch every day. Just beneath it sits a layer of fat that cushions the body and stores energy. Under that lies an incredibly important structure called fascia. Fascia doesn't receive nearly as much attention as muscles or bones, yet it quietly holds everything together. Imagine it as a flexible internal wrapping that supports your muscles, fat, nerves, and blood vessels while allowing each layer to slide smoothly over the next whenever you move. When fascia stays healthy, movement feels effortless. The tissues remain soft, flexible, and well supplied with nutrients through healthy blood circulation. Every time you stretch, lift, or reach for something, these layers glide over one another with very little resistance. Problems begin when circulation gradually slows in one area for months, or even years. Without enough fresh blood flow delivering oxygen and nutrients, the tissues become less active. Instead of moving freely, neighboring layers slowly begin sticking together. Over time, these sticky areas become thicker and less flexible, reducing the smooth movement that healthy tissue normally has. At the same time, tiny blood vessels known as capillaries struggle to deliver adequate nourishment. These microscopic vessels are responsible for supplying oxygen to individual cells and removing waste products. When they become sluggish, fluid no longer moves efficiently through the surrounding tissue. Instead of draining away as it should, some of this fluid starts collecting between the cells. You may not notice obvious swelling, but the tissue gradually becomes heavier, softer, and less supportive. This hidden fluid buildup often develops so slowly that people never realize it's happening. They simply wake up one day wondering why the back of their arm suddenly appears looser than it did a few years earlier. Gravity then adds another piece to the puzzle. As the tissue becomes heavier and its internal support weakens, the skin naturally begins to hang lower. The result is the familiar jiggle that many people mistake for stubborn fat. But here's the fascinating part. If fat alone were responsible, then losing fat from that specific area would completely solve the problem. Unfortunately, that's not how the human body works. Despite countless advertisements promising spot reduction, science has repeatedly shown that you cannot selectively burn fat from one body part using creams, wraps, or special gadgets. So if the issue isn't simply extra fat, what exactly should we be targeting? The answer involves restoring healthy tissue movement, improving circulation, encouraging normal fluid drainage, and reactivating muscles that have quietly become weaker over time. And that brings us to one of the simplest, but surprisingly powerful, techniques you can begin doing today. It doesn't require equipment, gym memberships, or expensive appointments. In fact, all you need are your own hands. That sensitivity isn't something to fear. In fact, It can give you valuable clues about the condition of the tissue beneath your skin. The technique begins with a simple action. Reach to the back of your upper arm and gently lift a very small amount of skin between your thumb and fingers. The key word here is small. Many people instinctively grab a large handful of tissue, but that usually misses the area we're trying to influence. Instead, take tiny pinches across the surface, moving gradually from one spot to another. If certain places feel unusually tender or sharp compared to others, don't assume something is wrong. Those sensitive areas often indicate that the tissue layers have become less mobile over time. Healthy tissue slides smoothly. Tissue that has remained inactive for years often loses that freedom of movement. As you continue this gentle pinching technique, you're encouraging those layers to move independently again. Think of 2 pages in a book that have become damp and stuck together. If you patiently separate them little by little, they eventually begin moving freely once more. Your skin and the tissue beneath it respond in a surprisingly similar way. This gentle mechanical stimulation also encourages fresh circulation to enter the area. As blood flow improves, oxygen and nutrients are delivered more efficiently, giving the body's repair systems the resources they need. Among the most important workers involved in this process are specialized cells responsible for producing collagen. Collagen is one of the body's primary structural proteins. It acts like an internal framework that helps skin remain firm, resilient, and capable of bouncing back after movement. While collagen production naturally changes with age, these cells still respond to healthy circulation and proper mechanical stimulation. When tissues receive adequate oxygen and nourishment, they function far more efficiently than tissues left inactive for long periods. That's why consistency matters much more than intensity. You don't need to pinch aggressively or leave bruises behind. In fact, using excessive force can irritate the skin and create unnecessary discomfort. Gentle, controlled pressure performed regularly is far more effective than occasional, overly aggressive sessions. Many people notice something interesting after practicing this technique every day for 2 or 3 weeks. Areas that were once extremely tender gradually become less sensitive. Some mistakenly believe this means the exercise is no longer working. Actually, the opposite may be true. As circulation improves and the tissue becomes more mobile, those sensitive spots often become noticeably more comfortable. That's one sign the area is responding positively to regular attention. If you have someone willing to help, a spouse, family member, or trusted friend, you can also try another technique often used by manual therapy professionals. Instead of simply pinching individual spots, your helper gently lifts a narrow fold of skin and slowly rolls it forward across the back of your arm. Imagine creating a small wave beneath the skin and allowing it to travel along the length of the upper arm. For healthy, mobile tissue, this movement usually feels fairly comfortable. But if the tissue has remained tight and inactive for years, the sensation can be surprisingly intense. Many people are shocked by how uncomfortable those first sessions feel. That reaction doesn't necessarily indicate damage. More often, it reflects how restricted the tissue has become after years of limited movement and reduced circulation. The encouraging part is that this discomfort usually decreases with consistency. Week after week, the skin often feels softer, more flexible, and easier to move. Even before dramatic visual changes appear, many people notice that the tissue simply feels healthier beneath their fingertips. But improving the quality of the connective tissue is only half of the equation. The skin covering your upper arm depends heavily on what's underneath it for support, and that's where many daily routines fall short. Think about how often you use your arms throughout a normal day. You carry groceries, you answer your phone, you type on a keyboard, you pick up children or grandchildren, you open doors, you reach forward countless times. Most of these activities rely heavily on the muscles located at the front of the arm and the chest. The muscle along the back of the upper arm, the triceps, often receives surprisingly little meaningful work during everyday life. Over months and years, this lack of challenge allows the muscle to gradually lose strength and firmness. Muscles aren't only responsible for movement, they also create the foundation that supports the tissues lying above them. When muscle tone declines, the overlying skin loses part of its natural support system. Even healthy skin can begin looking looser simply because the structure underneath isn't providing the same level of firmness it once did. The good news is that rebuilding this support doesn't require complicated gym equipment. One of the most effective movements targets the triceps directly while allowing people of nearly every fitness level to participate. The secret isn't performing hundreds of repetitions. It's using proper technique. A narrow hand position with your elbows kept close to your sides shifts much more of the workload onto the back of the arms instead of allowing the chest and shoulders to do most of the effort. If traditional push-ups feel impossible right now, don't be discouraged. There's absolutely nothing wrong with starting against a wall. Wall push-ups provide genuine resistance while placing far less stress on the joints. As your strength improves, you can gradually progress to using a countertop, a sturdy bench, or another elevated surface before eventually working toward floor push-ups if your body is ready. This gradual increase in difficulty is exactly how muscles become stronger safely. There's no prize for rushing the process. Your body responds best when it's challenged, just a little more than before, not overwhelmed all at once. As the triceps regain strength, they begin creating firmer support beneath the skin while simultaneously encouraging healthier blood flow throughout the entire back of the upper arm. When this strengthening is combined with the tissue work you've already learned, the two approaches reinforce each other, producing far greater benefits than either method alone. Strengthening your triceps is important, but there's another piece of the puzzle that many people skip without realizing how much it matters. They finish their workout, wipe away the sweat, and move on with their day. Unfortunately, by ignoring this step, they're missing an opportunity to help their muscles recover, improve flexibility, and maintain healthier connective tissue. That missing step is stretching. Some people think stretching is only for athletes or people who practice yoga, but the truth is that every muscle benefits from moving through its full range of motion. Healthy muscles aren't just strong, they're flexible, well supplied with blood, and able to move without restriction. An effective routine follows a simple sequence. First, gently prepare the muscle with a light stretch. This helps increase mobility before exercise begins. Next comes the strengthening work, where the muscle performs the effort needed to become stronger. Finally, once the exercise is complete, another stretch allows the muscle to gradually relax while encouraging healthy circulation during recovery. This pattern isn't just about feeling good after a workout. It supports the body's natural recovery process. Whenever muscles contract repeatedly, they produce small amounts of metabolic waste as a normal result of activity. A proper cool down helps your circulation clear these byproducts more efficiently while bringing fresh oxygen and nutrients back into the recovering tissue. Over time, this contributes to better flexibility, reduced stiffness, and improved overall muscle function. Fortunately, stretching the triceps is simple. Raise one arm overhead, then bend your elbow so your hand reaches down behind your head. Using your opposite hand, gently guide the raised elbow backward and slightly inward until you feel a comfortable stretch along the back of the upper arm. The stretch should feel noticeable but never painful. Hold the position for about 20 to 30 seconds while breathing normally. Avoid bouncing or forcing the movement farther than your body naturally allows. If you'd like to deepen the stretch slightly, lean your upper body toward the opposite side. This also lengthens muscles along the side of your torso and upper back, giving you additional mobility without adding extra exercises to your routine. However, it's important to remember that more isn't always better. Your shoulder is one of the most mobile joints in the human body. That incredible freedom of movement allows you to reach overhead, throw, lift, and rotate your arm in countless directions. But increased mobility comes with reduced stability. Unlike joints that rely heavily on bone structure for support, the shoulder depends largely on muscles, tendons, and connective tissues to remain stable during movement. If you've previously experienced a shoulder injury, such as a dislocation, rotator cuff problem, or ongoing pain, listen carefully to your body's signals. Stretching should create a gentle pulling sensation in the muscle, not sharp pain inside the joint. Pain is information. It's your body's way of telling you that something deserves attention. Ignoring that warning and forcing your way through discomfort can turn a minor issue into one that takes weeks or even months to recover from. If shoulder pain regularly interferes with daily activities, it's wise to seek guidance from a qualified healthcare professional who can evaluate the joint and recommend an appropriate rehabilitation plan. Protecting your joints today helps preserve your ability to stay active for years to come. Now let's explore another movement that looks incredibly simple, but works through a completely different mechanism than stretching or strength training. This exercise involves controlled arm swings. At first glance, it may seem too easy to make a difference, yet when performed correctly, it introduces something unique: momentum. Instead of slowly holding a position, you're allowing the arm to move freely through a comfortable swinging motion. As the arm travels forward and backward, the tissues experience gentle acceleration followed by controlled deceleration. During the farthest point of each swing, the muscles and connective tissue experience a brief stretch that differs from a traditional static hold. At the same time, your muscles work to control and slow the movement before reversing direction. That combination creates two beneficial effects within a single exercise. The connective tissue experiences repeated gentle lengthening, while the muscles remain lightly active throughout the motion. Sports rehabilitation specialists frequently include similar dynamic movements because they help restore natural mobility while preparing muscles for more demanding activity. These swings also make an excellent warm-up before performing your strengthening exercises. Only a minute or two of relaxed movement can increase circulation and prepare the shoulder, elbow, and upper arm for the work ahead. There's no need to swing forcefully or as fast as possible. Smooth, controlled motion produces better results than aggressive movement. Quality always matters more than speed as you continue practicing these daily habits: gentle tissue work, progressive strengthening, stretching, and dynamic movement. You may begin noticing improvements that extend beyond your arms. Many people are surprised to discover that the body rarely changes in isolation. The same connective tissue that supports the back of your upper arms also plays an important role throughout the rest of your body. When collagen and supportive tissues gradually weaken over time, similar changes may begin appearing elsewhere. Some people first notice softer skin around the jawline or neck. Others observe reduced firmness around the abdomen. Still, others experience changes in the strength and elasticity of tissues supporting their joints or blood vessels. Rather than thinking of these as completely separate problems, it can be helpful to view them as different expressions of the body's overall connective tissue health. That raises an important question. What influences the body's ability to build and maintain strong connective tissue in the first place? Exercise certainly plays a major role. Healthy circulation matters as well. But there's another factor that often receives far less attention than it deserves: a nutrient that affects much more than bone health alone. And understanding its role could completely change the way you think about maintaining healthy skin and connective tissue as you get older. That important nutrient is vitamin D. Most people associate vitamin D with strong bones, and while that role is certainly important, it represents only a small part of the story. Researchers continue discovering that vitamin D influences many systems throughout the body, including muscles, the immune system, and the cells responsible for maintaining healthy connective tissue. One of the body's most important structural materials is collagen. Collagen acts like an internal support network, giving strength and flexibility to the skin, tendons, ligaments, blood vessels, and many other tissues. Every day your body breaks down old collagen and replaces it with newly produced fibers. When that balance shifts, the visible signs often begin to appear on the outside. Skin may become less firm. Joints may not feel as stable. Recovery from physical activity can take longer. Even small changes in connective tissue gradually become more noticeable over the years. Vitamin D helps support the normal activity of specialized cells involved in collagen production. When the body has adequate levels, these cells can perform their job more efficiently as part of the ongoing repair process. When vitamin D levels remain low for extended periods, however, that repair system may not function as effectively as it should. The result isn't something that happens overnight. It's a slow process that develops quietly over months and years. Many people don't recognize the signs until the changes become visible in the mirror. One reason vitamin D deserves attention is because deficiency is remarkably common across the world. Modern lifestyles keep many people indoors for most of the day. Office work, long commutes, limited outdoor activity, and regular sunscreen use can all reduce the amount of vitamin D the body naturally produces through sunlight exposure. Older adults may also produce less vitamin D through the skin compared with younger individuals. People living in regions with long winters or limited sunlight often face additional challenges. Those with darker skin tones may require more sun exposure to produce similar amounts of vitamin D because increased skin pigmentation naturally reduces vitamin D production. These factors help explain why so many adults unknowingly have levels below what's considered ideal. The encouraging news is that vitamin D status is easy to evaluate. A simple blood test can measure your level and help determine whether you're within a healthy range. Rather than guessing or taking extremely high doses on your own, it's much safer to discuss the results with your healthcare provider. They can recommend an appropriate supplementation plan if one is needed while helping you avoid taking more than your body requires. More is not always better. Like many nutrients, vitamin D works best within a healthy range. Once deficiencies are corrected, many people notice benefits that extend far beyond a single area of the body. Healthy connective tissue supports muscles, joints, blood vessels, and skin simultaneously. That's why improving one underlying factor may positively influence several aspects of overall health rather than addressing only one cosmetic concern. Of course, nutrition is only one piece of the larger picture. Movement remains equally important. The combination of improved circulation, regular muscle activation, healthy tissue mobility, and proper nutritional support creates an environment where your body can perform the repair work it was naturally designed to do. Another factor worth considering is age. Time changes every part of the human body, including the speed at which collagen is produced. Beginning in early adulthood, collagen production slowly starts to decline. For many years, the changes are subtle, making them easy to ignore. As the decades pass, however, the difference becomes more noticeable. The body continues breaking down older collagen every day, but replacing it becomes a little slower than before. This gradual shift explains why skin may not recover its firmness as quickly after weight changes, why muscles require more effort to maintain, and why consistency becomes increasingly valuable. By the time many people reach their 40s and 50s, these natural changes become much easier to see. That doesn't mean improvement is impossible. Far from it. It simply means the body benefits even more from regular movement, proper nutrition, resistance training, and healthy daily habits. The earlier these habits begin, the greater the opportunity to maintain strong connective tissue over the long term. However, even if you're beginning later in life, meaningful improvements are still possible. The body continues adapting throughout adulthood whenever it's given consistent, appropriate stimulation. That's one of the most encouraging facts about human biology. Your body is constantly responding to the choices you make every day. Small actions repeated consistently often produce results that occasional intense efforts never achieve. Before we finish, I'd love to know something about you. How old are you? Share your age in the comments below. It's always fascinating to see the range of viewers following these health discussions, and it also helps shape future videos around the questions that matter most to different age groups. Now that you understand what's happening beneath the surface, let's bring everything together into one simple daily routine that's practical, realistic, and easy to stick with. Because lasting results don't come from complicated programs. They come from doing the right things consistently. Now let's put everything together into one simple daily routine that is easy to remember and even easier to practice. You don't need an expensive machine, complicated gadgets, or hours in the gym. What matters most is consistency. A few focused minutes every day can accomplish far more than occasional bursts of effort followed by weeks of inactivity. The first step is the manual tissue work. Spend about 5 minutes gently pinching and lifting small sections of skin across the back of your upper arm. Move slowly from one area to another, paying attention to places that feel especially tight or sensitive. Don't rush through the process or squeeze hard enough to bruise yourself. The goal is simply to encourage healthy tissue mobility while stimulating circulation beneath the surface. As the days pass, you'll likely notice that the tissue begins feeling softer and more flexible. Areas that were once uncomfortable may gradually become easier to work with. That's often a sign that the tissue is responding to regular movement and improved blood flow. The second step focuses on rebuilding the muscle that supports the skin. Choose a level of push-up that matches your current ability. If wall push-ups are where you need to start, that's perfectly fine. As your strength improves, gradually progress to a countertop, sturdy bench, or another elevated surface before eventually attempting floor push-ups if your body is ready. Remember one important detail throughout every repetition. Keep your elbows close to your sides. This simple adjustment shifts much more of the workload toward the triceps, helping strengthen the muscles that support the back of the upper arm. Focus on controlled movement rather than speed. Slow, steady repetitions performed with good technique are far more effective than rushing through a large number with poor form. As your triceps become stronger, they create a firmer foundation beneath the skin while also improving circulation throughout the surrounding tissues. Next comes stretching. Before beginning your strengthening exercises, spend a few moments gently stretching the triceps to prepare the muscles for movement. After completing your workout, repeat the stretch again to encourage flexibility and support recovery. This simple habit helps maintain healthy range of motion while allowing muscles to relax after being challenged. If you'd like to add another useful element to your routine, include a minute or two of gentle arm swings before exercising. These relaxed swinging motions help warm the tissues, increase circulation, and prepare the muscles for activity without placing unnecessary stress on the joints. Combined together, these 4 habits create a balanced routine. You improve tissue mobility. You stimulate circulation. You strengthen supportive muscles. You maintain flexibility. Each step complements the others. No single exercise works like magic on its own. Instead, it's the combination of healthy daily habits that allows your body to perform the repair processes it naturally carries out every day. Just as important as paying attention to your overall health. If you suspect you may have low vitamin D levels, especially if you spend little time outdoors or have risk factors for deficiency, consider discussing testing with your healthcare provider. Correcting a nutritional deficiency may support not only your skin and connective tissue, but also your muscles, bones, and overall well-being. Think of your body as one connected system rather than a collection of separate parts. When you improve circulation, nutrition, movement, and muscle strength, the benefits rarely stay confined to one small area. Healthy habits have a way of creating positive changes throughout the body. It's also worth remembering that loose skin doesn't develop overnight. Months, or even years, of gradual changes lead to what you eventually see in the mirror. Because the process develops slowly, improvement also requires patience. Don't expect dramatic changes after just a few days. Instead, pay attention to the small victories. Maybe your arms begin feeling firmer. Perhaps the tissue becomes less tender. You may notice improved strength during your exercises or greater ease performing everyday tasks. These small improvements build upon one another over time. Consistency always beats perfection. Missing a single day won't erase your progress. What matters is returning to your routine and allowing healthy habits to become part of your lifestyle. The human body has an incredible capacity to adapt. Given the right conditions, it continually repairs, strengthens, and remodels itself throughout life. Supporting those natural processes is often far more valuable than searching for quick fixes that promise overnight transformations. Your skin isn't working against you. It's providing feedback about what's happening beneath the surface. When you respond by improving movement, strengthening muscles, supporting good nutrition, and staying consistent, you're doing much more than addressing appearance. You're investing in healthier connective tissue, stronger muscles, better mobility, and long-term physical function. That's a goal worth pursuing at any age. If you found today's information valuable, let me know in the comments which part of this daily routine you're planning to start first. I'd also love to hear your age and whether you've already noticed changes in the back of your arms or are beginning this routine as a preventive step. If this video helped, you understand your body in a new way, don't forget to like this video, subscribe to the channel, and share it with someone who could benefit from this information. Your support helps us continue creating practical, science-based health content, and together we can help more people take control of their health naturally. Until next time, stay active, stay consistent, and take good care of yourself.